the price of the pump program might be offloaded to patients. And it will be offloaded to patients.
Albertans with type 1 diabetes are calling on the government to provide more clarity on the new changes to the provincial insulin pump therapy program.
I never received a letter in the mail, and it was released to the public without any explanation.
A government news release issued earlier in the week stated the insulin pump therapy program would be replaced by a government-sponsored health benefit plan on August 1st. The current program covers the cost of insulin pumps that help about 4,000 patients across Alberta manage diabetes by administering insulin as an alternative to multiple daily injections.
I was taking injections for a majority of my life. And finally got myself a pump, and I think my life changed completely.
Jasmine McGarrah was diagnosed with type 1 diabetes when she was just 12. She says before she enrolled in the program, she could not afford a pump. Now she's worried if the coverage changes, it would impact her ability to receive treatment if she had to pay out of pocket.
Unfortunately, I don't have a plan B to be able to afford the insulin pump by myself. So I guess plan A is to go back to injections.
Another Edmontonian I talked to also expressed frustration with the lack of information around the upcoming changes.
You need to have a continuous glucose monitor integrated with it. That costs $300 a month. There's really no point in even accessing those unless you can afford that extra cost.
Alberta's health minister, however, saying the changes will allow Albertans to access more advanced technology while also saving the government some $9 million per year.
For those who don't have private coverage, they can get coverage through Blue Cross, so they will have some premiums associated. But really, this is setting us up for success down the road.
But McGarrah, who's also a diabetes researcher at the University of Alberta, says the cost is just being diverted into the future.
If your blood glucose is uncontrolled for many years, you end up getting complications. And those complications cost a lot more money in the long run.
In a statement to City News, opposition NDP health critics David Shepherd says, quote, "I have heard from a large number of Albertans who are concerned that this program will create new costs for them and potentially put their current treatments out of reach."
I'm curious to see how they came up with this decision, if they consulted with patients or if they consulted with any medical professional. Because most medical professionals would say your blood glucose control is #1 priority.
In Edmonton, Heba Kamal Shufi, City News.